Beaufort Memorial Hospital is looking to improve treatment times for cardiovascular patients. Right now, the hospital is able to get a patient with heart problems from the emergency room to the cath lab in less than 90 minutes. But today, nurses and doctors put their skills to the test to try to get that number even lower.
Low Country reporter Georgia Godfrey has an exclusive look at the hospital's emergency heart attack drill.
Making sure hospital staff knows the quickest and most effective procedures when treating a patient. The clock starts as soon as a patient is admitted to the ER.
The ER physician identifies the patient as having a STEMI. They have, within 10 minutes of them hitting the door, they've had an EKG and they're calling us. Our time frame is from the time they hit the ER door to the time we put a device in is we have 90 minutes.
That's why the hospital holds these emergency drills quarterly.
They can actually come to Beaufort Memorial now. We can fix them with angioplasty and stenting, but there are cases when we have to move them to a tertiary care center.
The helicopter just landed. Paramedics will now go inside the hospital and get the patient from the cath lab.
We're working on our times from the time we hit the door to the time a patient gets on the table. And if we have to make an emergency transfer, we want a small window, about a 30-minute window from the time we call them to the time they get here. And then we want to work on that process of getting out of our lab into the helicopter.
This is the last step of the process. I know it's a little loud, you can't hear me, but the patient has been placed in this helicopter to be transferred to the nearest facility with a higher level of care. In Beaufort, Georgia Godfrey, WTOC News.